An Iowa farm must euthanize over 5 million chickens after the deadly bird flu virus was found in their flock. Dr. Devi is with us. And Doc, we just have to ask, people are really worried about this and they need to hear it over and over again. Can this jump from the chickens into humans?
It has in a couple rare cases, but it's extremely rare for that to happen. So I don't think people should be worried about that. I mean, of course, it's a major concern for the industry because it can spread from bird to bird and it's deadly. I think the reason that we do worry about it in general is because the virus, it's actually pretty deadly. So it doesn't spread to humans, but the worry that you have is that, let's say somebody gets bird flu, that one individual, and somebody also gets the regular flu at the same time, maybe those two viruses could mutate with each other and then cause something more deadly and more contagious.
What's the deal with this? How do these viruses like the avian flu, how does it come and go? We don't have it for a couple of years and then all of a sudden it reappears. How does that happen?
It's hard to know. I mean, some of these viruses can kind of sit in places and be hidden, sort of like chickenpox might hide in your body and then come back later as shingles. So we're not sure exactly how that happens, but it's hard to get rid of it because it's so easily spread between birds.
All right, now something a little bit different for you. Scientists are now saying spider venom can be used to treat chronic pain. Tell us how that works.
Well, it's not out yet, but they're looking at developing it. I mean, I think it's pretty promising that we're looking at venoms. I mean, snake and spider venom can actually immobilize people and then help with pain. But the danger is, I mean, we have drugs right now that can stop pain. The problem is that they work on other things too. So if you, let's say, get general anesthesia before surgery, your pain will be gone, but you'll be asleep because it works on the brain and puts you to sleep. And same thing if you get Novocaine before a root canal, you won't feel pain maybe from that root canal, but you won't feel your mouth either. You might lose your sense of taste. So the problem is, how do we get rid of pain?
What about also the abuse of these drugs now, prescription drugs to fight pain? I mean, this is a huge epidemic in this country.
It's a huge problem. So the idea that we could have other medications that might work, I mean, you don't need just medications, but the idea that you could use other things that might not cause an addiction, that's very exciting. The problem here again is that, will it have other side effects, even working on muscles or other things? And of course, if you get rid of all your pain,
how long would something like this take? Because, we read about this stuff and then it kind of goes away, and 5 years from now we'll read about it and it kind of goes away, and
it depends.
Are we relatively close on these?
Maybe. I mean, when I say relatively, I would say maybe 5 to 10 years if I had to guess, because we have used venoms for other types of pain medication, and we have used toxins too. Even Botox is a toxin. But the thing is, they have to have backers, they have to have enough interest, and then it has to go through so many different phases, safety and efficacy.
And ultimately you have to find a way to make a synthetic version of it, right?
Yeah, exactly.
Who's going to warehouse that many spiders?
Sure.
All right. Dr. Devi, thanks a lot.
Nice
really
seeing
appreciate
you.
it. Emac, I thought you were going to jump in there.
Well, I think pain medication, big as a boomer's age.
Yeah, I got you. All right.